Dr. Hantel, in your study focusing on sociodemographic associations with uptake of novel therapies for AML, can you describe those findings and what they might mean for patients from diverse backgrounds, particularly those with lower socioeconomic status?
So, in our study of sociodemographic associations with the uptake of novel therapies for AML, we found that patients from diverse backgrounds, particularly those with lower socioeconomic status and those who identified as Black, Asian, or other, in this case, non-Hispanic minoritized groups, actually face disparities in accessing some of the new treatments that we have for AML. And we know that there are a number of new treatments for this disease, but that many of these treatments are more expensive and are given as outpatients. And in these cases, this can be great because it allows people to not have to remain in the hospital like some of our own therapies, but also means that really this is putting more of the logistical burden on families and on patients, meaning that you have to have somebody who's potentially more sick at home rather than in the hospital where there's nursing and a lot of other caregivers that isn't on the caregiver at home. And then we also have the increased, burden of actually bringing the person back and forth to the hospital, taking more time off work, and all of the money also that's involved in that. And so this can translate into some disparities by socioeconomic status, which means that people with less means are less likely to get these medications. And these same groups are also less likely to be seen in practices where these newer drugs are likely to get prescribed. And so together, some of the study findings that we saw were more that these drugs were being less taken up by people with those backgrounds and by practices that see those patients. And in the end, we know that these novel therapies are being approved because they offer something new, either that's better or that expands treatments to newer groups who are unlikely to have as great options before. And so we want to really provide these treatments to everybody who's eligible for them. And we shouldn't think that eligibility requires really a different amount of money or different types of personal characteristics. Could just be equitably available to everybody. And addressing these disparities kind of involves a very complex set of considerations, such as making sure that patients who are stable enough to do so can go see AML specialists and consider more of these novel therapies, that all patients are educated about their treatment options and the logistics of different treatment choices, and that they're provided with all of the avenues of support available to them. Some of these can be through societies like the Leukemia and Lymphoma Society, which can connect patients with a variety of support services, including more informational services, as well as direct financial support to be able to either obtain these drugs or work with companies and other places to figure out how to maintain or how to obtain these drugs. So my activation tip for this question would be for patients who are newly diagnosed and considering different treatment options that may be available to them, is working with both your clinical team and looking outside the clinical team to other well-known support services like Leukemia and Lymphoma Society to see if there are additional financial and other resources that can be obtained in order for you to be able to avail yourself of any treatment option that's available would be very helpful.